there are other things, our energy expenditures and energy utilization system. There are other hormones, other peptides. These are called leptin and prispalin, visfatin, adiponectin, all this stuff. They work on hand in hand like an orchestra. I call it fat symphony, hormone symphony. The boss man is leptin, was actually discovered by a good friend of mine, a brother called Jay Friedman. So these leptin actually called fatgenic hormone that comes and releases from the neurohormone brain and gives order. So this leptin, when you have a high sugar, leptin actually that time works low. When there's a high amount of insulin, low. So low leptin is bad disease. And then to fight another hormone called adiponectin, higher the adiponectin, lower the sugar and lower insulin resistance lower. So altogether what happens, these complex, they work hand in hand, or they disarray, not making any discordant noise, is diabetes. So this diabetes is called fat diabetes or type 2 diabetes. So this diabetes is another harbinger of inflammation. So remember, all this stuff and obesity, not only in really hitting one organ, which is liver tissue, but other two. It hits where? Pancreas, it hits brain. Why? The hardening of the arteries called atherogenesis, atherosclerosis, by this fat deposition, causing the heart. Most of the people with fatty liver die of what? Heart attack first. Then it affects gonads, means our sex organs, by the vessels. Then it affects the joints. Why? The joints are squished. Imagine you have a foundation for 2-family house and you decided to 6-family house. What happens? The blood, the pump is 2 families. They're overloaded, which is heart. So all the pipes are overloaded. Why? Because they're only for 2 families. So, and then on top, to look into this, so the joints, the foundation, are breaking because of pressure, pressure, pressure. A simple analogy, right? So no matter what, it is the obesity. There are other neurohormones, neuropeptides, affects that, called retinol binding protein. These are big names. But altogether, this orchestra, once is the maestro didn't work well, what happens? It's disarray. So these are the integral important factors called fatty liver. But there are other fatty liver we call NAFLD, another one called BAFLD, which is both alcohol and fat, or diabetes. It's a baffling situation. There's another one called miscellaneous. I call it MAFLD, is my term. So MAFLD means there are drugs involved there, there are other diseases involved there besides diabetes, called Cushing disease. There's another type of medication, it's called steroid. Steroid is worse. If you take steroid, Solomedrol, for a month, your liver is fine. Okay, so how many times you use this medication for lupus, for arthritis? So ongoing problems with this medication. So not only you culminate or pinpoint one person is the culprit. So if you have to squeeze and tweak one person is the culprit, is called obesity and diabetes, from the obesity diabetes. So what all these things after the liver is injured, causing inflammation, so liver gets fat and causing pressure. That's the clinical signs. Very vague. You're tired and fat, liver gets bigger. Normal liver size would be underneath the rib cage, about 9 to 12 centimeter. But when it goes beyond 14 centimeter, it's definitely fatty liver. So what happens, there is a cover called capsule. The capsule is stretched, so what happens, pain from here, pain goes back. And then if you look at the simple blood test, you look, the ALT enzymes are high. So it could be double or what, and there are other enzymes.
So you could feel physical pain.
Yeah, physical, yeah, but
it's just again, on your side.
Right, but it is so vague, and there are so many other elements called pain. And these type 2 diabetes and obesity can also cause gallbladder stone, because that's very common in this case. And gallbladder stone can cause pain as well. So besides the pain and fatigue and stuff, so fatty liver keeps on going, and then once the liver, the whole tissue pattern, that means think about a meatloaf. If you cut it, that looks inside like a real liver tissue, kind of. But if you see inside is all white and on droplets of fat, it's fatty tissue. So there is no liver tissue left. So that goes into the end-stage liver called cirrhosis. The pattern of cirrhosis actually is called fibrosis. That means after the inflamed liver, the mitochondria, the cell batteries are dead, not working, and they spill out some system called interleukins 1, 2, 6, 8, 10, 12, and eventually brings something which is a strong inflammatory marker called TNF-alpha, tumor necrosis factor alpha. And then that brings, so that time they send the message to the liver, say, we are not well, let's bring to salvage, to fight. Who comes in? Something called Kupffer cells. So Kupffer cells are the immune cells dedicated, destined in the liver tissue to fight. Then comes in who was one of the cells, looks like stars. That's called stellar cells. They are there in between the liver tissue. There are areas called fenestrations and areas, and these areas called space of DC, not DC, DC. So this space, all this stuff move around, which is all the liver cells, Kupffer cells, and so on, and blood tests. So there are blood thin blood flow too. So it's a triad. You cut on a nerve, on a regular wire, electrical wire. You see green, blue colors. The same colors going through this. So inside the cells come in, and these stellate cells, they have the energy of vitamin A called retinoic acid. They squeeze out and they get fatigued and tired. They take a different shape, and this shape is an elliptical shape. It's called myoepithelial cells. And these myoepithelial cells are the first harbinger of putting the brakes, which is called fibroblast, and that causes fibrosis and cirrhosis, contracted. Another example, if you get tissue burn, and after burn you see the ugly picture of a different tissue contracture or a keloid, this is a typical fibrous tissue caused destruction of liver. But liver starts regenerating, remember?
When does the liver stop? Is there a point where there's no return?
Right. So cirrhosis, once it is cirrhotic, which has two components. One is called compensated cirrhosis. 20% people died of car accidents. On autopsy, they found they're cirrhotics. They didn't even know. So these people are walking with cirrhosis. They're compensated cirrhosis. That can reverse. That cirrhosis, I mean, in our medical school, we learned that cirrhosis cannot be reversed. It's wrong. Again, for audience, it's wrong. Tell your doctor if they have that you can reverse cirrhosis, go back to the normal. Only the compensated cirrhotics. But if you have decompensated cirrhotics, which you have jaundice, water in your belly, your brain doesn't work, encephalopathy, you're having flapping tremor, and that doesn't come back. You need transplantation. There's no way out. So that's, again, the end stage of liver. So we look into this module, computerized module. Right now, 55% people are fat, and NASH maybe 20%. And after that, remember, from NAFL, which is without inflammation, 4% go into NASH and cirrhotics directly. And now we found out this regenerative change can cause cancer. De novo means without anything else we found out the cancer, fatty liver cancer, big thing now. And then it becomes cirrhotic, decompensated, and we think 2030 would be having about NASH would be the predominant cause of liver failure and cirrhosis. Why? Right now, if you take three pathologies, three clinical problems, hepatitis C was number one causing cirrhosis of liver and liver failure in all the transplant. Number two was alcohol. Of course, alcohol was the most accepted toxin in our whole society over years and years, and that is caused. And then slowly and arrogantly going up, which is NASH and NASH cirrhotics. So in future, in 2030, the most amount of transplantation will give into NASH-oriented cirrhosis, NASH cirrhosis. And we think about $30 to $40 billion first. So now our generalized consensus is to everybody, every household, that exercise, control your diabetes. And if you ask me what are the markers, biological, biochemical markers, very simple. Simple is if you're not feeling well and if you're obese, simple blood test. It doesn't have to be fasting blood test to look into the enzyme system, and then look into something called HOMA score. The HOMA score is a specific indices of insulin resistance, and you can measure insulin as well. So in this case, the plan of therapy and treatment is weight loss, and exercise. Exercise again and again. Whoever over 35 to 40 years, please tell your audience, go check with their cardiologist, because you never know what's their heart condition. So they do never exercise, suddenly they go into vigorous exercise, can get into sticky situations, so heart disease, heart attack, right? So in this case, must consult cardiologist. And then diet-wise, low carbohydrate diets. There are so many, Scarsdale to low fat, low carbohydrate to protein diet to so many diets. And no, I'm not addressing any diet, but again, that diet, 1600 calorie, you can do it and exercise, and then you can reverse this. And if you have inflammation, it's called NASH, the only therapy so far is vitamin E. And if you are diabetic or pre-diabetic, the measure is called hemoglobin A1C. If it is over 6.8, then you take a PPR gamma. There are so many medications available like this, or some gliptins, and follow up with your doctors. Remember, go follow up with your doctor every 3 months and get a sonogram as a base to see how much fat you have in your liver.
So use the sonograms, use the staircases versus the elevator. Make sure to go to your cardiologist. And make sure to follow all the rules and regulations Dr. Basu just said. And then thank you so much for your interest in the show and your desire to become involved and educated. It's so important for you and your families to really understand the disease state awareness and understand what you could be going through. And there's cures, there's chances now for this to be healed. So please, we invite you to visit our website at www.medcastplus.com and check out our tools and connect with us on social media. We want to hear from you. We want to know what interests you or what we should do different or better to make it more to your understanding and beliefs. Contact us at 718-510-2103. Please stay well and be safe. And again, I'm your host, Helen Bays, and this is Dr. Patrick Basu, and we thank you so much for taking out the time to joining us today.